Hello, my name is Muriel Schwen, and I'm a nurse practitioner at Massachusetts General Hospital. The goal of this video is to help you prepare for surgery by reviewing why and how to use a special soap prior to your surgery. Using an antimicrobial soap before surgery can lower your chances of a skin infection where the surgery is done. The soap lowers the amount of bacteria on your skin. The soap comes in the form of wipes and liquid soap. We will provide you with the soap. Shower or bathe with the soap once a day for 3 days before your surgery, with the last shower being the morning of the surgery. So you will use it 2 days before, 1 day before, and the morning of the surgery. Use the soap instead of your normal body soap. Use it from the neck down with a focus on your underarms, groin area, and stomach area. For each shower, use the soap on your body for 5 minutes before rinsing it off. On the morning of the surgery, after you use the soap for the final time, do not put on makeup, lotion, deodorant, hair gel, powder, or perfume. You can wash your hair with your normal shampoo and brush your teeth. In rare cases, patients may have an allergy or sensitivity to the soap. If this happens, there are alternatives that your healthcare provider can suggest. Please reach out for such guidance. We hope you have found this video helpful. Please contact your care team if you have questions.